So we will be discussing today some of the special leads that we might use in recording the ECG. So we'll be discussing today the two different sets of special leads that we might use. The first one is V7, V8 and V9. So in general, if we talk about the precordial leads, they range from V1 till V6 and they are located in front of the chest, and V7, V8, V9 are just the continuation from V6 onwards. So the location of the V7 is going to be in the posterior axillary line. The location of V8 is going to be at the inferior angle of scapula. The location of V9 is going to be lateral to the spine. And all of them are going to be at the same level. And that level is the level of V6. Then the other type of leads that we have is, you can see as the number suggests, V3R, V4, V5, V6 and R is written in front of the numbers. So the R stands for right side. So what do we basically do is that we will let the V1, V2 stay at their place, but we will be picking up the leads V3 to V6 and put them on the right side of the chest. But if you see, when we discussed the above sets V7, V8, V9, we did not do anything to the leads numbering V1 to V6, we just added 3 more leads. But in this set, we are actually going to shift the V3 to V6 leads towards the right side. So the location of V3, V4, V5 and V6 will be the same as that of these leads when they were on the left sides. So the V4 is going to be in the mid-clavicular line in the 5th intercostal space. V3 lies between V2 and V4. V5 is going to be in the interior axillary line, and V6 is going to be in the mid axillary line, and all of them are going to be at the same level, that's around 5th intercostal space. So this was actually the positioning. So we are actually done with the positioning. The next thing comes, when are we gonna record the ECG using these leads? That is the practical implication of using these leads. So we will be recording V7, V8, V9 when we suspect posterolateral, just want to correct it, when we suspect posterolateral MI. And this is something that you are gonna suspect when you will be seeing reciprocal ST depression in leads V1 to V3. The moment you see ST depression in leads V1 to V3, there is a possibility that you might have posterolateral MI. So when you will be recording these 3 leads, you will be seeing ST elevation. But this is something that you might not see if you hadn't done V7, V8, V9. The only thing that you would be seeing is an indirect evidence of posterolateral MI in the form of ST depression in V1, V3, which is a reciprocal ST depression. So the use of V7, V8, V9 is in detecting posterolateral MI. And this is something that you would suspect when you see reciprocal ST depression in leads V1 to V3. So this is the main use of these 3 special leads. Next we come on to the V3 to V6 right leads. So we are gonna basically record the ECG in these leads when we will be seeing ST elevation in inferior leads. So inferior leads are lead number 2, 3 and AVF. So the inferior leads actually are indicating the electrical processes occurring in the right ventricle. So whenever you see ST elevation in the inferior leads, you can change the direction of the leads and put it towards the right side, and you will be able to see ST elevation in these leads, indicating that there is a right ventricular myocardial infarction. So the concept is same as that of posterior lateral MI, right? So the moment you see ST elevation in the inferior leads, you can shift the leads towards the right side and you'll be seeing ST elevation in these leads, indicating that a right ventricular myocardial infarction might have occurred. There are other two important usages of these leads. One is in detecting dextrocardia, and the second one is right ventricular hypertrophy. So that is pretty much about it. So you see that how we can use special leads to detect posterior lateral MI or right ventricular MI mainly. Thank you.